Hey there, Dr. Alan Christianson here. This one's going to be very tactical about improving your cortisol metabolism and some pitfalls to look out for. I had a patient recently, really neat gal. She had been suffering with adrenal problems, and she was diagnosed as having very low adrenal function. And her cortisol scores were well below ideal for the morning and the noon. They were more normal afternoon and evening, but they were markedly low, no doubt about it, early in the day. And we call this being crashed. You know, in the new book, The Adrenal Reset Diet, I talked about levels of adrenal distress. And crash is probably the most far along one. People at this level can be just horribly fatigued and depressed and have aches and pains and just not be functioning well. And it can also affect sleep badly and weaken the immune system and probably create a long-term risk. It's a big deal, and it's very important to correct. So it seemed really intuitive to her prior doctors that since her cortisol was so low, she would do better if it was higher. And if she could achieve that, it would be helpful. But ironically, taking cortisol was not really a path back to health. So they saw that her cortisol was low. They gave her pills of hydrocortisone, which is pretty similar to the cortisol your body makes, and her scores were higher. Well, the problem was she put on about 20 pounds in the first few weeks. Never happened before. You know, this was a gal to where her weight fluctuated no more than about 4 pounds all of her adult life. She was in her mid-40s, and even as early as high school, her weight was where it had been up until she took the hydrocortisone. So she gained a ton of weight. She also had pretty severe acne show up, and she had bad fluid retention and severe anxiety. So she wanted to stop it, but the doctor was concerned about her needing to go through a long taper process. So she ended up being on it for several months and had pretty substantial weight gain, bad skin, some hair thinning, and other health problems from it. She did come off, and she was still in that state. And I was able to work with her and help her out and recommend some basic dietary ideas, you know, getting sunlight in the morning, using some simple herbs to help her body make cortisol better. And we saw her scores come up over a period of time, and they did improve. So why didn't cortisol help? You know, it seems so logical, and I totally understand the doctor's reasoning that, you know, here this thing off causing symptoms. Why couldn't you just pop it up and make things work better again? Well, here's what's going on. The adrenal glands, there are times in which they cannot do what the body wants them to do. There's diseases. The biggest one is one called Addison's disease, and that's an autoimmunity of the adrenals. So the immune system attacks the adrenal glands, it breaks them down, and it makes it to where they can't produce enough hormone for your needs. And in that state, someone needs to take something like cortisol. And oddly enough, even in that state, hydrocortisone is probably not the best fit. We use different versions that are more effective. But yeah, the person will be healthier by having it than they will by not having it. There's a signal from the pituitary to the adrenals telling them to make hormones. We call that ACTH, or adrenal corticotropic hormone. And in cases of Addison's disease, there's no cortisol being made, and there's a very high level of ACTH. So if you can understand what's happening, your brain is yelling at your adrenals to work, and they're not working. So your body's trying to get something done that it's not getting. So in that case, it is smart to give it what it wants. Now, in the case of being crashed, or being wired or tired, or being stressed, so that's adrenal dysfunction. And if we look at the ACTH level, it will not be elevated. So there is low cortisol, but the body wants low cortisol. So in this case, her system didn't really want the cortisol from her own body. She was capable of making it, and she did make it at certain times, but her body didn't want it because it was really just run down and exhausted. So it took rest, relaxation, rejuvenation, and restoring her cycles, her daily rhythms, to allow her body to want to make cortisol again. So by just going in and pouring cortisol in, was fighting against what the body was trying to achieve. And that's why she had so many troubling side effects from that. So this was a quick message, just a warning out there. If you have had problems with your adrenal glands, many times doctors do like to give hydrocortisone. And I totally get the logic. I understand it. And there may also be times in which you feel better at first. You know, it can act as a stimulant. And if you're tired, it can be not surprising that you may feel a burst of energy or more stimulated for a period of time. But unless you really have a disease in which you can't make cortisol, you won't be moving your health in the right direction. You know, you won't be working with your body's attempt to come back to homeostasis. So we always have to distinguish things that seem to feel better in the short term from things that really move you towards a state of more resiliency. And that's the goal. We want you to feel better because you are better. We don't want you to feel better and be tricked. We want you to feel better because your health is improving and your vitality is increasing. So if you're crashed, take a good look at the chapter on crashed in the new book and think about botanical medicines, think about timing of light, and think a lot about rest and all the factors that gave rise to it. And your blood sugar is a critical one too. So really manage all the factors that raise your resiliency and know that you can do better and that your cortisol production can come back again. But if you take cortisol, you're not giving your body what it wants. You're giving your body what it's trying to avoid. And you'll also make it harder for you to make more by yourself because you'll even pull away from your adrenals that much further. So you can get better, you can improve, and it's all totally possible. We'll talk again soon. Dr. Christianson here.